Today I will be talking about the heart condition called ventricular tachycardia. To begin, there are 4 chambers of the heart: the right and left atrium and the right and left ventricle. A heart rate beating faster or anything above 100 beats per minute is termed tachycardia. Ventricular tachycardia usually has the high rate of about 250 beats per minute. Now, normally when the heart has an electrical impulse, it begins in the sinoatrial node, also known as the SA node. It then produces a ventricle contraction. Abnormal ventricle impulses start in the ventricles with premature ventricular contraction, or PVC, which is a single beat. When there's 3 or more consecutive beats in this term, this is termed ventricular tachycardia. This fast beating heart is not able to pump out enough blood sufficient enough to sustain the brain and the rest of the body. Now, common causes of ventricular tachycardia include heart conditions such as coronary artery disease, heart disease, or previous heart attacks. Some medications and recreational drugs can cause this condition as well. Symptoms include chest pain, fainting, dizziness, short of breath, and worst case scenario, sudden death. Diagnosing ventricular tachycardia is accomplished with the use of an electrocardiogram, or ECG, to measure electrical activity. This example shows the Q, the P, the Q, the R, the S, and the T. This complex right here represents the depolarization and contraction of the ventricles, muscle fibers. An ECG with someone with this condition will have a more frequent, closer together complex. Monomorphic VT is signaling coming from one signal in the ventricles. There's also polymorphic VT, is multiple signals coming from ventricles at different rates in different areas. Treatment of ventricular tachycardia include cardioversion, which is induced by means of medication or electrical deliverance on the R of the QRS complex. There is also radiofrequency catheter ablation, and lastly, implantable cardioconverter defibrillation. And that's how you treat that condition. Now, prevention of VT is exercise, refraining from tobacco use, and taking meds to reduce high blood pressure and high cholesterol. Thank you so much.